Thank you very much, and thank you, Senator Marshall. Thank you, Mr. Chair, for this hearing, and thanks to our witnesses for being here. Dr. Inglesby, I wanted to start with a question for you. Artificial intelligence can be helpful when designing new tools to combat the threat of antimicrobial resistance. For example, researchers at the NIH have found that machine learning algorithms can quickly analyze patterns in antimicrobial resistance. This can obviously help public health authorities respond to outbreaks of resistant infections more quickly and efficiently. Artificial intelligence also has the potential to help doctors more precisely diagnose and treat an infection with the right antibiotic at the right dose. So as an expert in health security, can you speak to the role that artificial intelligence plays in our fight against antimicrobial resistance?
Yeah, well, thank you very much for the questions. Very, very important set of issues around AMR. I think there are a number of ways that AI could help in the fight against antimicrobial resistance, and you have mentioned many of the major ways. The first is the design of new therapeutic approaches. We've talked about how new protein design tools, kind of in the category of AI biological design tools, could accelerate the development of new therapies, but also AI can help us with looking at the combination of therapies in ways that were not necessarily obvious through human judgment. So combinations of therapies, they can move from interpreting the sequences of pathogens and making predictions about resistance, and we begin to see that in experimental approaches. We just need kind of a strong data set to be able to move forward on that, but lots of potential.
Well, then, as a follow-up, how can Congress help support the use of AI to better predict and combat AMR?
Yeah, well, I think it depends depending on the category of approaches. I think new therapeutic approaches, I think making sure that BARDA, HHS, and FDA are oriented around new AMR approaches and have the flexibility to make new therapeutics. There are a number of different approaches that BARDA has been pursuing around that. And I think making sure that the data sets that are being developed around these microbes is robust. And I think people talked about the federated approach, making sure that institutions across the country can work together, anonymize data, anonymize patient data, and develop the data sets we need to make those predictions.
Well, thank you for that. I'm going to move now to Dr. Mandel? Dr. Mandel, artificial intelligence has played an integral role in the widespread adoption of electronic health records. Algorithms can help physicians categorize and structure patient data, making it easier for healthcare providers to access and use. While this has the potential to boost productivity and allow providers to spend more time with their patients, we need standards in AI for medical settings in order to ensure that patients are receiving the best possible care and that their privacy is protected. So how can Congress support the development and implementation of these kinds of standards?
Thank you very much for that question. The delivery of AI through electronic health records will clearly be a very important channel for how AI gets to the point of care. For one thing, I think it's very important in that context so that we optimize innovation and excellence to be modular in the way we integrate AI with electronic health records to make sure that innovators can get to the point of care outside of the electronic health record, but within clinician workflows as well. We want to be sure that the innovation and that the decisions that lead to the kinds of outcomes, good and bad, that you're talking about are not all channeled through a small set of companies, but through the full power of American innovation. I refer to, in my testimony, application programming interfaces. So under the 21st Century Cures Act, there are actually methods to integrate outside technology with electronic health records so that we can move the data to where it needs to be and implement those standards widely. The importance on understanding how AI is working is going to be very heavily placed, I believe, on continuous monitoring. While understanding the algorithms and testing the algorithms is extremely important, until you know how they perform in the real world, you can't fully evaluate them. And these large language models no one understands. No one understands exactly how they work or exactly how they produce their output. So we're poking the bear and testing. And so there has to be this interactive testing and measuring. And that's how we'll begin to see what emerges. And there has to be collaboration across multiple sectors so that we're all on the same team.
That's very helpful. Thank you. And thank you again to all the witnesses. Thanks, Mr. Chair.